In today's fast-paced world, mental health is gaining more recognition and understanding than ever before. With the prevalence of conditions like depression and anxiety, pharmaceutical interventions have become increasingly common. One such medication that is frequently prescribed is Celexa. In this comprehensive guide, we will delve into the uses, side effects, and other important information about Celexa. Celexa, also known by its generic name Citalopram, belongs to a class of medications called selective serotonin reuptake inhibitors, SSRIs. It is primarily prescribed to treat major depressive disorder, MDD, in adults and adolescents, as well as panic disorder, obsessive-compulsive disorder, OCD, social anxiety disorder, SAD, and generalized anxiety disorder, GAD. The mechanism of action of Celexa involves increasing the levels of serotonin, a neurotransmitter in the brain, by inhibiting its reuptake by neurons. This helps in regulating mood and reducing symptoms associated with various mental health conditions. Like any medication, Celexa comes with a list of potential side effects that users should be aware of. Common side effects include nausea, dry mouth, drowsiness, insomnia, increased sweating, and sexual dysfunction. It's important to note that not everyone experiences these side effects, and they may vary in severity from person to person. In addition to the common side effects, there are some more serious side effects associated with Celexa that require immediate medical attention. These include allergic reactions, suicidal thoughts or behavior, serotonin syndrome, a potentially life-threatening condition characterized by agitation, hallucinations, fever, sweating, shivering, fast heart rate, muscle stiffness, twitching, loss of coordination, nausea, vomiting, or diarrhea, and seizures. Before starting Celexa, it's essential to discuss your medical history and any other medications or supplements you are taking with your healthcare provider to avoid potential interactions or complications. Celexa is typically taken orally, once daily, with or without food. The dosage prescribed will depend on the individual's condition and response to treatment. It's important to take Celexa exactly as prescribed by your healthcare provider and not to suddenly stop taking it without consulting them first, as doing so can lead to withdrawal symptoms. While Celexa can be an effective treatment for depression and anxiety for many people, it's not without its controversies and concerns. Like all SSRIs, Celexa carries a black box warning from the FDA regarding the increased risk of suicidal thoughts and behavior, particularly in children, adolescents, and young adults under the age of 25. It's essential for individuals taking Celexa to be closely monitored, especially when starting the medication or changing the dosage. In recent years, there has also been growing scrutiny over the long-term use of SSRIs and their potential for causing dependence and withdrawal symptoms. Some users report experiencing discontinuation syndrome when tapering off Celexa or other SSRIs, which can include flu-like symptoms, dizziness, sensory disturbances, anxiety, agitation, and insomnia. This has sparked debates within the medical community about the appropriate duration of SSRI treatment and the best practices for discontinuation. Despite these concerns, Celexa remains a widely prescribed medication for depression and anxiety, and for many individuals, it can be a valuable tool in managing their symptoms and improving their quality of life. It's essential for individuals considering Celexa to weigh the potential benefits against the risks and to work closely with their healthcare provider to monitor their progress and adjust their treatment plan as needed. In conclusion, Celexa is a commonly prescribed medication for depression and anxiety, belonging to the class of SSRIs. While it can be effective in alleviating symptoms for many individuals, it's essential to be aware of the potential side effects and risks associated with its use. By working closely with healthcare providers and staying informed about the latest research and recommendations, individuals can make informed decisions about their mental health treatment options.